But the country they've returned to is very different.
Was it a surprise to see the army here?
Yeah, just nice to be home.
This is the new national regime, enforced from midnight. Inside the airport, all arrivals are screened before being sent to mandatory quarantine.
I think it's good.
It'll be fun.
But some anxious relatives watched on. Andrew Cowling has grave concerns about his 85-year-old father.
I don't know how any of this is going to be managed by the government in any way. They've got dietary requirements, health requirements, and they're locking them up in a hotel.
Raj Kumar wants his 19-year-old daughter at home to self-isolate.
I'm very frustrated, I'm very angry. What's going on? I just come here to pick her up.
Young and old, everybody had to get on board. The first busloads went to Sydney's luxurious Intercontinental.
Are you ready to quarantine whole family in one room?
It's going to be interesting.
Others remained stuck on the buses.
Sitting outside the Intercontinental, but unfortunately 3 hours have now gone.
And then they were sent elsewhere.
And we've been directed to go to the Ibis. So something pretty seriously wrong has been happening with getting people into the Intercontinental.
Finally, Peter O'Connor made his destination.
Well, after 5 hours out of the airport, hanging around the Intercontinental in a bus, and now good old-fashioned Ibis. This is basic. Mr. Prime Minister, I hope you know what you're doing.
That's where he'll stay for 14 days, fed, housed and isolated like the other thousands of Australians returning home.
And if they in any way try to avoid that, they run the risk of an $11,000 fine and a 6-month jail term.
There's a reason the government is enforcing hotel isolation because, like other attempts at social distancing, some people simply weren't getting the message. Authorities were flabbergasted when a group of 33 doctors landed at Sydney Airport from Chile on Friday and dodged police to board domestic flights instead of checking into a hotel as directed.
I actually don't know what to say about those doctors. They are the people who you would expect to know better than anybody else. So yeah, it's bitterly disappointing.
So was this.
Evacuate now.
A fire alarm forcing people isolated in one hotel back onto the streets. Ashley Raper, ABC News, Sydney.
In Victoria, a man in his 80s has become the fourth person in the state to die of coronavirus. 84 new cases have been confirmed, bringing the total to 769, and those people range in age from 3 to 88. 39,000 people have been tested, but health professionals are worried that's not enough, and they're being left under-resourced and anxious about their own personal health. Elias Kluwer reports.
In the battle against the coronavirus, the government is fighting it on the beaches. Today it seemed even Mother Nature couldn't keep some indoors.
It is stupid behaviour. We all need to do our bit.
The renewed orders for people to stay at home where possible come as a fourth Victorian died in hospital after contracting the virus. He was a man in his 80s. The number of confirmed cases is now approaching 800. But as cases rise, those on the front lines say they are grossly under-resourced and can't even get basic protective equipment.
The equipment's needing to be reused for disposable things, not ideal. People are trying to work out how to wash disposable masks. You know, some of my colleagues are actually producing DIY personal equipment.
Personally, I've had to dip into my own personal resources to fund my own protection. However, I know there's lots of doctors out there who might not be in a position to be able to do so.
The fear is doctors will contract the virus, which will put even more pressure on a health system bracing for impact.
We really feel let down in terms of actually protecting us in the front line.
The Victorian government says it has ample PPE supplies and doctors just need to ask for it. But many health professionals have told the ABC that they haven't been told this. Other medical professionals have expressed concern over the level of testing here in Victoria, saying it's lagging behind. Victoria has completed 50,000 less tests than in New South Wales and 13,000 less than Queensland.
Well, I think Victoria needs to lift its game. It needs to be more efficient.
The AMA says the lack of testing could be hiding the true spread of the virus.
What we're about is doing more tests so we can get a greater understanding of the true number of cases in the community.
Another challenge in an evolving crisis. Elias Kluwer, ABC News, Melbourne.
Taking you to some breaking news now, and Queensland police have shot dead a man after a 12-hour standoff near Cairns. The man was shot in waist-deep water at Tomatsis Creek off the Captain Cook Highway after he allegedly raised a firearm towards police. He was critically injured when police returned fire and was pronounced dead at the scene. An investigation by Ethical Standards Command has begun. Well, overseas now, and Donald Trump has backed away from a proposal to close several state borders, including New York, despite the infection rate climbing. State governors slammed the radical plan, and the president now says he will issue a strong travel advisory. North America correspondent David Lipson reports.
Adorned with flags and much fanfare, the US president sends comfort to struggling New York.
This great ship behind me is a 70,000-ton message of hope.
The hospital ship will arrive in 2 days to help ease the crushing burden on New York's health system. Video posted on social media shows emergency rooms already near breaking point.
Who's the sickest patient you should know? I don't know.
Fearing much worse to come, under-resourced healthcare workers are publicly pleading for help.
If you have any face masks, supplies, please consider donating them.
The president spent the day publicly weighing up whether to seal off 3 states to slow the spread of infection nationwide.
We'll be announcing that one way or the other fairly soon.
It took the New York governor by surprise.
Have you had any indication that that's a possibility for New York or parts of Connecticut?
I haven't had those conversations. I don't even know what that means.
By day's end, President Trump tweeted a quarantine wouldn't be necessary, rather a strong travel advisory. More and more international borders are also being sealed. Qantas is starting to wind up its overseas services. Australians trapped abroad are running out of options.
Yeah, come on, let's pack the bags.
Jared Whittaker flew out of Chile with his family today. He was told it was the last Qantas flight home.
For me, the overwhelming feeling here is just relief. We're going to get out.
The wedding they were meant to attend was cancelled. Then they spent several weeks in a military-enforced lockdown as tensions grew on the streets.
Just given that this isn't just a medical emergency, it's an economic one. If things go bad, people start dying, people start losing their jobs, there's that potential for this to really boil over into something much bigger.
There are countless other Australians trying to get home. Time is running out. David Lipson, ABC News, Washington.
Well, with their death toll still rising sharply, Europe's worst-hit countries are preparing for extended restrictions. 10,000 people have now died in Italy, the first country to pass the grim milestone. Preparations are accelerating in the UK, with dire predictions it will soon face a similar emergency to the one on the continent. Europe correspondent Samantha Hawley reports from London.
COVID-19 forced the Prime Minister to chair the emergency meeting on the pandemic via video link. From tomorrow, he'll also be communicating by letter, warning every British household the outbreak will get worse before it gets better, and stricter controls may have to come into force, saying, "We will not hesitate to go further if that is what the scientific and medical advice tells us we must do." Even the best-case scenario the experts are predicting sounds bleak.
If we can keep deaths below 20,000, we will have done very well in this epidemic.
It's the grim reality Britain is now preparing for. What was once a convention centre, now being transformed into a hospital. A growing fleet of ambulances at the ready. And precious testing kits are being prioritised for health workers so they can get the all clear and end self-isolation early.
It's really frustrating because I know the hospital's busy. Even at this relatively early point, things are really hotting up.
Officials say the death toll will be higher if people ignore the social distancing directives. It'll take 2 to 3 weeks for Britain to reach its peak. Then the country will know if the measures put in place have helped to slow the spread. In Italy, the disaster seems to have motivated the whole country to heed the lockdown orders. It's come too late. Italy is the first country to record 10,000 deaths from COVID-19. Spain is the second worst hit European country, with a total of 5,000 deaths. This building was meant to be part of a new Madrid legal precinct. The project was abandoned after the Great Recession. Now it's found a new purpose as a morgue. A place designed to be a grand city of justice is now a city of the dead. Samantha Hawley, ABC News, London.
New Zealand has recorded its first coronavirus death on day 4 of a nation.